This systematic review and meta-analysis found that curcumin was significantly more effective than placebo in the improvements for pain, function, and stiffness. In addition, they found that the effects of curcumin were just as strong as taking non-steroidal anti-inflammatory drugs such as ibuprofen and naproxen in the improvements of pain and function without any of the side effects. NSAIDs are known to cause serious side effects, especially when taken long-term. Complications include gastrointestinal bleeding, renal failure, worsening hypertension, and cardiovascular complications such as heart attacks and strokes. Turmeric and curcumin are an excellent and safe alternative. The typical recommended dose is 1,000 milligrams daily. The third supplement that I recommend for arthritis is glucosamine chondroitin. Now I want to point out that clinical studies consistently show that both Boswellia serrata and turmeric curcumin have greater benefits than glucosamine chondroitin. So if you're looking for somewhere to start, I would start with those two first. But for those who want to try everything, let's talk about glucosamine chondroitin. Both of these are naturally occurring compounds found in joints and cartilage. Their use has actually been quite controversial over the last few years. A number of clinical studies have shown that glucosamine and chondroitin can reduce joint pain and improve function in people with osteoarthritis of the knees, hips, and spine. But the evidence for their effectiveness is not consistent across all studies, and some studies have found that they are no more effective than taking placebo. And one of the reasons for this may be that many clinical trials only study glucosamine versus placebo, or chondroitin versus placebo. They don't actually study the two compounds together. And because of this, these studies ignore the synergistic effects that the two supplements have when taken together. This systematic review and meta-analysis looked specifically to determine if glucosamine chondroitin taken together was effective for the treatment of osteoarthritis. They found that the combination of the two supplements significantly decreased pain, improved function, and decreased stiffness when compared to placebo. The typical recommended dose of glucosamine is around 1,500 milligrams, and chondroitin is between 800 and 1,200 milligrams daily. Again, just remember that glucosamine and chondroitin should be taken together to achieve the best effects.